And we are.
All right, so this is Senate Health and Welfare coming back, and we're going to take a look at the latest and what we're hoping will be the final draft of S-36, and then consider a vote, have discussion and vote. And the last time we met on the bill, I think there was an interest to collect data about where the assaults took place, what kind of assaults were they, what were the arrests that were taking place. So in that discussion, I heard back from public safety and the folks who actually collect the data, and then from the commissioner, Jennifer Morrison, and we have that, her letter on our webpage. And the difficulty of putting, they can do it, they can get data, they can get us a minimal amount. But to get the data that we want will take a different level of, a higher level of work, more work to do it. So based on that, I asked Eric to keep the draft as it is and not put a report in. And rather than try to put something half-baked into the bill, let's take this message across to the House. So whoever reports the bill can let the House know that the reporting piece might be something they could evaluate. Because we simply don't have the time, and frankly, I think that the Judiciary Committee would want to weigh in on that as well. So the bill that we have here, it's draft 3.1. I think the final draft will clean up the markup clean. I think it'll be 3.2, and Eric has that for us. So the last decision that we were on, as you go through, look at page 2. There's markup there on the disorderly conduct, and then on the language that we looked at earlier in the week. So if we don't have our lawyer with us, unfortunately, but anything, if we make some kind of an error in our thinking, we can always look at this while it's on the floor. So this is about healthcare facilities and healthcare violence to board healthcare providers. That interferes with the provision of medically necessary healthcare services.
Which page is?
I just went through the whole thing.
Okay.
I just briefly looking at it. We got through it a lot. Any discussion? Yeah.
Need a motion?
Straw poll, yeah. I do need a motion.
I'll make a motion that we vote on this.
Okay, so that you would vote favorably on, I believe it'll be draft 3.2. We can clarify the exact draft number with Eric, S-36 to send to the full Senate for consideration.
Correct. I'll second.
Oh, good. Do you want to give our clerk? You're going to record the vote.
Yeah, but
Motion.
Can we wait for Senator Hardy?
No, we're going to vote. Yeah, she's been notified by him, and this isn't time to be in committee. But we will allow for her to vote when she comes back.
Okay. Can we have some discussion?
Discussion.
Okay, great.
Yeah.
I know you already said this, but just to clarify, we do have reporting on the de-escalation, which is great.
Yes.
And in terms of the hospital reporting on actual incidences, we're hoping that will come up in judiciary and that they.
No. What we're going to do, the bill will go across
As is.
should go across to the House.
Okay.
And then we'll recommend whoever reports the bill.
Yeah.
When they go up to the House to report the bill,
Mhm.
or just in communicating, can ask that the reporting piece be added in or evaluated, take testimony, and look
Okay.
at it, because it's more complicated than just asking for the data.
Okay,
They don't have the system now. They can do it, as Commissioner Morrison said, but it's problematic to put in this bill.
okay.
And so there is a motion on the table to vote favorably for, I think it's draft 3.2 when you take the highlights out. And we'll make sure that of S-36 to pass it favorably to the full Senate for a vote. That's what we
We
are.
don't have.
And we're in discussion.
Yeah.
Did you want to update Senator Hardy on the fact that the reporting?
Yeah, so as
Yeah, I think I heard what you were just saying.
Yeah,
But
so-
what I had said, I don't know if you saw my email from last night, it came late, so, that when and she was unfortunately not in the room, when I was talking to Devin, the conversation came up about who should do the reporting, and, because Eric is the judiciary drafter, he went to the, Vermont Crime Center kind of route. And Devin and I said, that's one possibility. There's another possibility, which is to have the healthcare facilities actually report on it. And because what I would like to know is how many people are actually arrested without a warrant because of this new sort of ability to do it, and for what reasons. So which of the 3 reasons is somebody arrested? And if we can't get the data easily through public safety and the criminal justice data, can we get the data from the healthcare facilities? And so that we would know how is this being used and for what purpose? Because I think that my discomfort with the last one, the disorderly conduct, maybe it would be, relieved by saying, oh, well, they never use it, or there was only this one time,
I
or
think
whatever.
there's a lot of agreement around the table, and I think that is the suggestion that we're making, is to take that suggestion to the House to improve the bill as it goes to the House. If there, and we may decide in here to put together an amendment. And Senator, if you'd like to do that, put together an amendment that would reflect what you have just said from the perspective of healthcare facilities, we could do that as a committee amendment. I'm glad to entertain that. I think where we are right now is a good place to move the bill favorably, and then either through an amendment on the floor or in the House. As we heard from Commissioner Morrison and her note yesterday, they can also do it. They can also provide information which would be helpful from the public safety perspective. So it might be a combination of both, so we can really get a robust return on this as we go forward. So I'm going to suggest, I think it's great. I think we all understand that, but we know we are in life. So let's go forward with it, and then if there's an opportunity to put together a committee amendment next week, we'll have time to consider that. Not a bad idea.
Okay,
Or we can just say, let the House deal with that particular issue and help them understand what our interests are.
Okay, I'll talk to Devin about trying to do a committee, an amendment, either if it's a committee amendment or just my amendment, because
I think it's a committee amendment. We've all been talking about this, and I think it's really a good idea.
Okay.
So let's try and do that together. We'll maybe bring Devin in and have her talk about it.
Okay.
Yeah.
okay, great. So there's a motion and a second to vote on
There is a motion and a
S36,
second, Madam Clerk.
to vote on S36 draft 3.2. I am
We
apparently
think it's 3.2.
We think
As
it's
cleaned
3.2.
up, it'll be
asterisk, we think
after
it's 3.2.
it says.
I am the first vote on this bill, and I will vote yes. And Senator Hardy,
I'm so reluctant, but yes.
Senator Williams.
Yes.
Senator Lyons.
Yeah, no, I'm
Sure.
last.
Chair
How could you do-
Weeks,
How could you do that?
Vice Chair Weeks,
Yes, yes, ma'am.
Chair Lyons.
Yes.
Thank you.
All right, that's good. Oh, thank you.
So the vote in committee is 5-0-0 on S36 draft 3.2.
Excellent, okay.
Great.
I'm looking for a reporter.
Don't look at, I mean, I'm not.
No, I'm looking at,
Terry, you haven't reported a bill yet.
She's reporting one today.
Oh,
are you the
Oh,
one
oh.
who's comfortable report?
Terry
Oh,
has-
Terry, I thought you said
Not really,
chair.
no.
Senator Weeks, are you?
When would it be?
Well, tomorrow it would go on notice and then it would be as early as Tuesday. Yeah,
Oh, I'm rushing for it.
And there'll be a judiciary report as well on this bill, I think.
that's,
Yeah,
yeah, this is just the healthcare report, so it'll also.
just our.
You do-
Can you explain that? 'Cause, yeah, I
Let
haven't
me
seen that.
I haven't
explain.
either.
Okay, I'll explain.
I'm
it.
gonna go back to do working
No.
on mine.
Please, don't go, we're gonna take a break in a minute. So S36 is a bill that began in judiciary. And S36 is a bill that began in judiciary. Then, because it has issues related to us, came to us. We are amending, this is our proposal of amendment, to amend the bill as it came to us from judiciary. So the judiciary will give the report of the bill. And then we will report on modifying sections of the bill. So we are modifying the judiciary report. Okay, so the section, you'll notice that, so in section, we might be modifying some of the language, and you and I can go through this together.
so do we have
Are
a
you
reporter?
okay with recording? It won't be a heavy one.
Yeah, most one.
Okay,
Great, thank you.
good. It's a really important bill. All right. So,
You owe me that.
I know.
don't worry, we'll get it. So, Alex, are any of our witnesses available?
Yes, Holly Davies is available.
Told you.
Thank goodness. Can you let Senator Hardy know that we're continuing to take testimony? Could we go off live for just a minute and then we'll come back?
Yes.